This video series was created for families who are considering having their baby at Mount Sinai Hospital and for those who have made that decision and are now preparing for their birth. The hospital is located at 600 University Avenue in downtown Toronto between St. Patrick and Queen's Park subway stations. It is across from the Hospital for Sick Children and flanked by the Toronto Rehab to the south and Princess Margaret Hospital to the north. When entering the hospital from University Avenue through the large revolving doors, you will find some of our corporate partner services such as Second Cup, Rexall, and Indigo. However, when in labor, most expectant families enter the hospital from Murray Street after parking in one of the parking garages available at the rear of the hospital. These parking garages are operated by independent contractors. It is possible to drop the laboring person off in the semicircle on Murray Street, but you are not able to leave your car there unattended. Once through the revolving doors, you will find our food hall to your left, security services to your right, and the admitting and patient registration area just ahead of you to the left. All labor rooms are private and OHIP will cover the cost for that room. When you're in the postpartum area, OHIP will cover a room that has 4 people in it, and if you would like to upgrade to a semi-private or a private room, then you may be able to do that through your private insurance company or a group insurance company. Insurance companies may cover only part of the cost of a private or a semi-private room, so you'll be best to check with your own insurance company to find out what they will cover. You will likely have to submit a form so that you can get reimbursed for it, but you may be asked to pay for it up front. Your postpartum room will not be assigned until after you have given birth. If your preferred room type is not available at that time, you will be given an alternate room type and placed on a waiting list for your preferred room type. If you think you're in labor, your water has broken, or you have any other concerns, please contact your healthcare provider. You can also call the triage line, and the number for that is 416-586-4800, extension 3210. A labor and delivery nurse will be able to answer your questions. Most women will come to the hospital when they are in active labor, with regular contractions every 5 minutes or closer for at least 2 hours, or when their water breaks. To find out more about how you will know if it's time to go to the hospital or when you're in labor, talk to your healthcare provider. Our prenatal classes also provide this information. Once you arrive at the hospital, you will likely be entering from the Murray Street revolving doors after you have parked your car. In order to register as an inpatient, you will need to have your OHIP card, your Mount Sinai Hospital card, and a credit card imprint for charges that are not covered by OHIP or your private insurance plan. Your registration will be managed during your assessment in triage. Do not go to the emergency department unless the pregnancy is less than 18 weeks along. To get to the university elevators, walk past the registration area just before reaching the second cup and turn left. The registration area on the 15th floor is found directly off the elevator lobby. You will be asked to come back to this area once you have been assessed in triage. To get to triage, turn into the hallway to the right of the registration area and enter the first set of doors to your right. When you get to triage, the triage nurse will take you into one of their examining rooms. She'll likely ask you some questions about your labor, a little bit of history about your pregnancy, and then she will listen to the baby's heart rate, check out what your contractions are doing, and take your vital signs. While in triage, a resident or medical student will do a quick history and physical to determine whether you are ready for admission to the labor floor. You will be transferred to a labor birthing room once you are in established active labor. If you are in early labor, you may be asked to go home for a time. If you live far away from the hospital, you may be able to stay in the early labor lounge on the 15th floor. The labor lounge is located directly across from the triage area. It has comfortable seating and offers you some privacy. To the right of the labor lounge, you will find a kitchenette with a kettle and a microwave for your use. To the left of the labor lounge, you will find the family waiting area. This is a good place to have family wait while you are being assessed. Your primary support person will of course be able to be with you while you are in triage. The labor and delivery unit is a locked unit, so if you are not accompanied by staff, you will need to use the telephone to be let in. The labor reception area is found across from where you will enter the unit. Once you are admitted to the labor and delivery unit, your partner or primary support person will receive a bracelet to identify them as a designated permanent support person. In labor and delivery, we encourage people to have just 2 visitors at a time, but your support person is, of course, able to stay for 24 hours. There are 19 rooms on the unit where families will be during the labor, birth, and immediate recovery period after the birth. All the rooms have showers in the bathrooms, and 4 of the rooms have immersion tubs available to use during labor. Showers have adjustable functions and a fold-down seat that can be used for the laboring person's comfort. Bathtubs do not have jets, but there is a handheld shower head that can be used to provide massage-like pressure. Each room is equipped with an adjustable bed, a lounge chair, a birth ball, a TV, monitoring systems for mother and baby, a baby warmer that can also be used to weigh the baby, a bedside table, and all the things nursing and medical staff will need to care for the laboring person and the baby. There is a storage area available for personal belongings. There is a kitchenette available for families to store labeled personal food items that require refrigeration. There is also a kettle and a microwave available. All cesarean births are done on the 15th floor in our own operating rooms. A resuscitation room is centrally located within this area, staffed by members of our neonatal intensive care unit team. Once the surgery is completed, recovery occurs in our own post-anesthetic care unit, located next to the reception area of labor and delivery. The baby will remain with you unless admission to the NICU is required. Once you have given birth and both you and baby are stable, you will be transferred to the postpartum unit by your nurse. The room could be on the 15th or 16th floor. You will stay on the postpartum unit for approximately 26 hours after your birth. If you've had a cesarean birth, it may be up to 48 hours. If you are with a midwife, you may be discharged earlier. Discharge classes run by a registered nurse and breastfeeding classes run by lactation consultants are offered daily to our inpatients. The unit has increased security, therefore visitors are required to use the phone by the entry doors to be buzzed into and out of the area. Visiting hours are from 11 a.m. to 8 p.m., but your primary support person can stay overnight. The communication station is located centrally in the unit, with decentralized charting areas for the nursing staff closer to the individual rooms. All rooms come with storage space for personal belongings, an adjustable bed, privacy curtains, a cot for the baby with storage space, a lounge chair that opens up to be used as a bed, TV, phone, and internet services, and bathroom and shower facilities. A separate bathroom with a shower is available for support persons staying overnight. If you are not in a private room, you may want to take advantage of the family lounge when visitors arrive. The kitchenette is also available for your use to store your own labeled food that requires refrigeration or to make yourself some tea. The Postnatal Ambulatory Clinic and the NICU or Neonatal Intensive Care Unit are both located on the 17th floor off the university elevators. The Postnatal Ambulatory Clinic serves as an interim support for the postpartum and neonatal period for both you and your baby after discharge from the hospital if you do not have access to a primary health care provider. Walk-ins cannot be accommodated, but you can arrange an appointment before you go home with your nurse, or you can call to make an appointment. Services provided here include breastfeeding support, newborn screening, follow-up, wound care, and other follow-up assessments. It is open 7 days a week. We hope that this video has given you a sense of what giving birth at Mount Sinai Hospital will be like. All of the information in this video is also available in the PDF file on the website. If you have further questions, please speak with your healthcare provider or consider taking one of our prenatal classes.